I'm very excited to welcome Dr. Zick, who's been a colleague for a number of years as well, kind of in my kind of previous world, I guess, for the most part, in biomedical prevention. And she is a naturopathic physician, actually, who's also a clinical investigator. Has done a lot of work in the field of kind of natural products, if you will. Okay, Dr. Zick.
Well, good morning. I know you guys have had a lively morning. I was listening to some of this. And I'm going to really kind of take a different path here and talk to you about diet and fatigue and also what little we know about melanoma and diet. So I hope that this gets you ready for whatever lunch you're going to be eating today. All right. I'm going to make sure I know how to do this clicker. There we go. So I always like to start out like, what are my inspirations? This is my husband with one of our dogs, Lucy, here, who obviously they love each other. They're both cancer survivors. My husband there had non-Hodgkin lymphoma, and she actually had a type of sarcoma. And they're both, by the way, doing well. But my husband, I can't account for Lucy. I think she probably isn't experiencing this. One of the things that has really happened during his multiple different treatments and now going forward many years later is fatigue. And it's something that often doesn't get addressed and is a problem for him. And there aren't a lot of options for him to actually feel better and to be able to engage with his family, his friends, his community, and of course, his favorite dog. So, is fatigue actually important? Should you, as people who have experienced cancer in your life at some level, think that it's important? Well, first, it's really good to say what's different about cancer-related fatigue as compared to everyday fatigue. I'm not talking about what a lot of us feel at the very end of the day, especially at the end of a work week. When we are feeling tired, all of us feel this. It comes and goes over the course of the day. That's normal. But really for cancer-related fatigue, as it says here, this is something that rest doesn't really address. It's continuous, and it just lasts longer. It's also been described as a whole body experience, just encompassing you. It's exhaustion, it's lack of energy, and it's a state. It's mental, emotional, and physical that goes above and beyond regular tiredness you might have from like running around to doctor's appointments, and the tiredness you have just from being stressed out. It's more than all of that. So across all different types of cancers, if you look, as we say, you will find fatigue, all right? And when you average that out, about 45% of all patients undergoing treatment, and that includes melanoma. We have issues in particular certain types of treatment, like interferon can be more of an issue, but what's been looked at. And I'll say it's been looked at less in melanoma than other cancers, but definitely during treatment is when it's more of an issue. But it also goes on after the end of treatment, and in some cases where they've been able to look in different cancers, even 10 years after the end of treatment, there's clinically significant fatigue that impacts things like ability to actually have a job. So this might be part of the economic toxicity that people have been talking about around cancer patients. So interestingly enough, when talking to different cancer patients, when we talk to them about GI issues, pain, depression, what they say impacts them the most is actually fatigue, that it's probably impacting across all these different domains. And something that has just been emerging and being looked at, particularly during cancer treatment, is that fatigue may be impacting survival, not in and of itself, but it may be an independent marker of things like recurrence and prognosis. And that even when you put it in there with tumor markers and other rather sophisticated molecular analyses, fatigue still comes up and says, if you have it, you're not doing as well. And I'm just putting on here, we've seen this in breast cancer survivors, high-grade gliomas, esophageal cancer, prostate cancer, myoplastic syndromes, just to give you an idea, and others. So once again, as people are beginning to look at this, they're seeing it, and we don't know why. So what do we have to offer people right now for treatments in fatigue? Well, one there is, not surprisingly, exercise. Both aerobic and anaerobic exercise has the strongest evidence that it helps with fatigue. But I'm going to put it up there. The number one barrier to starting or maintaining any type of exercise is fatigue. You guys got it. And as a matter of fact, secondary ones are like lack of motivation, which we know may also be fatigue, okay? So this is a problem. We also know that particularly in some populations like bone marrow transplant, if you ask people to do too much exercise, they actually end up with more fatigue. So there's really some issues with it. Also, you have cognitive behavioral therapy, which probably many of you have heard of. If you haven't, it's a type of psychotherapy. That also seems to be quite helpful. Unfortunately, there are few providers, as I show there. There's some stigma for some people about talking to healthcare providers. And probably a big barrier is there's not a lot of insurance for cognitive behavioral therapy. Now, people are trying to see, could we do this over the phone? Could we do it in shorter amounts instead of the typical kind of 6 to 8 weeks of treatment? But we're not really there yet. And so both of these things that could be helpful are not readily available or something that are easy for people to engage. So my group looks at different interventions. I'll also tell you we look at things like acupressure, which I'm not going to talk about today, but if any of you are interested and want to talk to me about that, or other integrative oncology approaches, which is kind of my area of research, we wanted to look at a diet. Now, there is very little information in cancer patients about diet and side effects and quality of life. Almost all of the treatments that have been looked at have either been for prevention, and I'll mention a little bit about that for melanoma in the next slide, or they've been looked at for like losing weight, which is great in some populations. You want to be able to lose weight or to maintain weight, depending on where you are in your cancer arc, okay? But not have been looked at for all these symptoms that people experience. Like I heard a gentleman saying, I had a lot of symptoms for my treatments right now. There's been only a few studies that have looked at that at all. So we actually had a trial that we had based on some evidence from some earlier work we had done in fatigue patients. And we developed a diet. But I want to just circle back for a moment and say, why diet for melanoma? Why might you specifically care if you don't have, say, fatigue, right? And so I have this charming picture here. Sorry, we have the whole fish. And nothing but the fish, as they say. So when they have actually looked at melanoma prevention, so this could be primary or secondary prevention, so helping you to prevent getting something in the future, there have been about 18 clinical trials that have been done, okay? Not clinical trials, actually observational studies, looking, and you hit about a 40% reduction of risk through time if you eat certain things. They're not going to surprise you. Fruits, particularly fruits high in vitamin C. So raspberries, I'm going to say that since we're in raspberry season still, as well as oranges, for instance, or kiwis. Also, fruits and vegetables. Vegetables in particular, you want these things high in beta-carotene or vitamin A, which has also been found to be protective. So squashes, sweet potatoes, carrots. So this is a great season to add those sort of things in. But all vegetables in general, and also the fatty fish. So salmon, tuna, sardines, mackerel. All these things that are really high in heart-healthy oil, the omega-3 fatty acids, which probably a lot of you have heard of as well. Although it was eating fish, by the way, not taking the supplement, that actually did this. So when I talk about my diet for fatigue, what you're going to notice is there is a lot of overlap. So it's nice to know that there might be mutual benefit from following a diet, both for increasing your energy, so boosting your energy and impacting sleep quality, which is something we looked at as well, by the way, and something that has not been looked at, as far as I could tell, in melanoma at all. So why diet for fatigue? Why would the quality of what you eat impact a symptom that you're experiencing? So I have this graphic up here. There is a theory. It's called sickness behavior. It came up with the fact that when you get a bacterial infection, it actually causes inflammation throughout your body, and it then causes inflammation in your brain. Okay? And the reason it does that is to actually cause an immune response to help you fight that bacteria or virus. And it changes neurochemicals, like neurotransmitters in your brain, and the connectivity within your brain, and actually causes symptoms that are listed here, like fever, malaise, depression, anorexia. And the reason for that was to protect you and your community from spreading that bacteria. So you weren't hungry now. You wouldn't go out and need to spend all that energy looking for food, and you kind of didn't want to be around other people. You were a little depressed and tired, so you would stay away and wouldn't infect them. However, if you have long-term inflammation, not short-term inflammation like from an infection, these symptoms can become maladaptive, and you can have long-term consequences for behaviors, including depression and fatigue. So the thought is that when you have a cancer, the biology of the cancer can be inflammatory. Also, treatments themselves, that includes radiation, chemotherapy, and surgery, all can cause increased inflammation, and some of our treatments, otherwise immunotherapies as well. So they actually increase inflammation, which crosses the blood-brain barrier and other areas into the brain and changes neurotransmitters. And our group has actually looked at some of these changes in the brain, and you can definitely see the difference. So we're beginning to put these pieces together to see why something like a diet, which could be high in antioxidant and anti-inflammatory nutrients, might be able to counter this effect and normalize a person, increasing their energy. So we did a study. These were in cancer survivors. These were adult cancer survivors. And just to show you this, because I heard a lot of people actually, you sound like you're really up on your science. So you had people in our fatigue reduction diet, and I'll tell you what that is, and something called a general health curriculum, where we talk to people about things about their health, like their oral health. We wanted to make sure that they spent as much time with our lovely research staff as the people who got dietary counseling, because we thought, just talking to a person who is thoughtful and supportive and talking about your health might make you feel more energy, right? Less fatigue. And so we matched them for the amount of time the two people talked to each other. And then everybody had telephone calls, right, at the beginning, and then once a week for the first month, and then every other week, so that we would have 3 months of them being on the diet or hearing about the general health curriculum. And then we looked at the end of the study to see how they were doing for both their fatigue and their sleep quality. Okay? And if any of you are really study methodologists, come on up and ask me details. So, just wanted to tell you, people ask me, how did we actually look at a subjective thing like fatigue or sleep quality? Okay? So we use something called the Brief Fatigue Inventory. Higher is worse, by the way. And that's something that was developed at MD Anderson Cancer Center to look at fatigue in cancer patients. And basically you can see there that at or above 4, you have moderate fatigue. At or above 6, you have severe fatigue, with 10 being the worst possible one. And that looks at both how it interferes with your life and how severe your fatigue is in the last 7 days, because it kind of goes back and forth. And then sleep quality is something called the PSQI, the Pittsburgh Sleep Quality Index. And you can see, once again, higher is worse. It goes from 0 to 21. But once you get at that 5 and above cut point, then you're considered a poor sleeper. Okay? So what was our diet? Well, once again, I'm going to tell you this is not anything you haven't heard, possibly from your mother. So basically, the first thing I'm going to tell you is it was really important that we not increase the number of calories people ate. Because, of course, for many cancer survivors, weight gain is actually not beneficial. Obviously, we wanted to keep them from gaining weight. So what you have to do to not do that for a person is swap. You swap out one food for another food that has essentially the same amount of calories in it and has kind of some similar macronutrients. And we call this same amount of calorie isocaloric, so same amount of calories. And our goal wasn't to make people lose weight, by the way. We wanted to improve quality through this swapping method. And so I have an example here. So you'd swap out a bag of potato chips. And by the way, it would have to be half a bag of potato chips, for one piece of fruit, right? So an apple or 2 apples for a bag of potato chips, okay? And we actually worked with people to individualize this with a registered dietitian. So if a person, just for the fruit example, hated apples but loved blueberries, we were fine with that. You kind of could go out there and do what really worked for you. So I'm sure you've been looking at this fatigue reduction diet, but I'll just say the highlights there, that half of all the food, the grains that you ate needed to be whole grain. So 100% whole wheat bread, oats, corn, brown rice, for instance, okay? That you had to have at least 5 servings of fruits and vegetables a day, and we broke these down. They had to have at least 1 serving of dark leafy green, like spinach, broccoli, kale. That yellow or orange we talked about, the pumpkins, the yams. Tomato, which actually, by the way, we had seen the strongest impact on reducing fatigue was with tomato. Who knows? And then they could have 2 or more of any of the above. It could be onions. It could be you name it. It had to be a vegetable source then. At least 2 servings of fruit per day, one of them high in vitamin C. And remember, I mentioned that for melanoma prevention, vitamin C was important as well. And 2 servings per day of one of those omega-3 rich foods. That could be vegetarian or non-vegetarian source. So it could be one of those fatty fish, that's salmon, sardine, mackerel, tuna. Or it could be nuts and or seeds. And so we emphasize things like walnuts. They're very high in the omega-3s. Flaxseed, which probably many of you have heard of. And of course, the really trendy one right now, chia seeds, which of course when I grew up, that was chia pets. But now they are, they're a superfood. So look where things will go, be careful. And also oils. Now I think olive oil is great, by the way, but it's not high in omega-3. Canola oil, which by the way is much less expensive, is very high in omega-3 and is something that we emphasized in people's diets. And we use daily checklist to help people very easily and simply track this per day. And I'll show you an example of that at the end. So I'll just tell you what the attention control people, just really quickly, what they got here. Here's an example. They maybe heard for 15 minutes where they talked about things like colorectal cancer screening. We wanted to make sure that this was something that people liked. And actually, they ended up really liking talking about these topics as well and learning about them. So here's our big take-home results. Okay? So on your right there are the results for the fatigue reduction diet. And what we're looking at is for the brief fatigue inventory there through time. So at the beginning of the study, people's average fatigue was 5.4. Okay, so that was at that kind of between the moderate to severe fatigue, and they went down to 3 on average. So that's a normal level of fatigue, by the way. So that's under 4. The Pittsburgh Sleep Quality Index, they started at 6.8, by the way, which is above that 5 cutoff for poor quality sleepers. And they went down to 3.9, which were normal sleepers. And for those who were above 5 at the baseline, just to let you know, because everyone in this study was fatigued, not everybody was a poor sleeper, you saw that they also went down to normal. What happened in the general health curriculum then? Well, basically what you're seeing for the brief fatigue inventory and for the Pittsburgh Sleep Quality Index is you had pretty much no change. Teeny little bit down, teeny little bit up. When you looked at these, when you see that little red star there, they were significantly different through time between the study arms. So there was a big difference in your fatigue reduction diet and nothing in the general health curriculum, which I was surprised about. I thought we would still see reductions from talking to nice people about your health, but we didn't. So it seemed to imply that there was something about the actual biology of the diet, the nutrients, and how it's impacting people's body outside of just talking to a person. So for sake of time, I'm going to go to how do you do this practically, what are some tools that we have? And I'd be glad to talk to people about other things that we did in terms of looking at that underlying biology as well and trying to figure out what the diet is doing. So to let you know, one thing that we really wanted to do was to create a way for people to understand how to do this diet. We have a lot of recipes, we have a lot of resources for people, but really what we wanted to do was put it out there so it was easy and accessible. So we created a Facebook page for people. And you can see that that's on facebook.com/FRDiet. Anybody can join it. And we post things on there about diet and exercise in general that we see. And we also have some neat graphics and recipes that I'll show you in a second. So here would be an example. So remember what I told you about needing to swap foods. So you just don't add foods. You actually swap one for the other to improve your calories. Your quality of your diet. So here we have Crazy Tuesday. That's when it got posted. Tempted to go out to dinner and order a hamburger? Reduce fatigue and save money by trying out this swap. Recipes for the Cajun rainbow trout coming tomorrow. Okay? So we made this infographic where we show you that for the average hamburger, and this is not one of those special double-decker varieties, right? It's 360 calories, right? And then we show you for 360 calories, you can have all of these other items, right? And you can have all these other items that help you to meet the goals for a fatigue reduction diet. So what you're basically seeing here is you have your rainbow trout, which is one of those omega-3 rich fishes, and you have a nice salad and a butternut stuffed squash. Yeah, I hope you're getting hungry for lunch now. And so we have all these things. And so, of course, you're saying, yes, okay, great, but then how do you actually then implement this? And then we have, yes, on Wednesday, you get the Cajun rainbow trout recipe, all right? So there you have it, how to make it, the methods to make it, and we have a little bit of information on the top about how this actually fills in with the diet, that it has rich in omega-3 fatty acids, fruits, and vegetables. You can see that you have a lemon there for a high vitamin C, etc. So along with that, on the Facebook page, on the side, we have free resources. One of them is the checklist that we use with people in our study. And just to let you know, when we use this checklist, people were able to meet about 75 to 80% of all their goals. So every day they checked it off, they met it, so they were able to adhere to this diet pretty easily. So what they got was this, and you could get it as well, where they put in the day, and then they check it off. Doesn't matter, you can do this online, or you can do it paper and put it on your refrigerator, for instance. You check it off, and you basically say, yes, I got my yellow-orange vegetable, I got my leafy green vegetable, I got my omega-3 fatty fish for the day. And also on the website, we have what a serving size is. So we taught everybody that. We have a nice slideshow to show you what a serving size is. You can also see that we have a little bit about that for fatty fish on the side. But that's something that's really hard for people too, to make sure that they have not too much, but enough. I don't worry about that for leafy greens. I worry about that for like nuts and seeds. I also really wanted to make you aware of another resource. At the University of Toronto, the Princess Margaret Cancer Center, I don't know if any of you, of course, I'm sure a lot of you have gone to Toronto, but I don't know if you've gone to their cancer center, has a great cancer survivorship program there. And part of what they have is a cooking and teaching kitchen. And their whole program, by the way, has the acronym ELIXIR, ELLICSR. Don't ask me to tell you exactly what that stands for. The C does stand for cancer. And they have the kitchen up there that is staffed by a really unique pair shown here by Stephanie and Jeremy. And Stephanie is a registered dietitian that focuses on oncology, okay? And Jeremy is a professional chef. So what they do is they teach cancer survivors how to actually take care of themselves and cook. So they have on their webpage here a beautiful YouTube channel. They have all these YouTube videos of them making recipes and Stephanie explaining why is this nutritionally important for cancer patients or when you might want to modify it. They also have great things like chopping techniques. So if you've never learned how to chop with a knife, because you have to chop when you do a lot of this cooking, they have it. So I think this is just a really great resource where you can go and get recipes, you can interact. They're always putting new things up. So I just want to show you all the people, always to say thank you for all the people and funders who helped with this work, and to of course, thank all the cancer survivors who went and boldly ate all this food, which, as I said, wasn't shocking in terms of what our grandmothers would tell us. But I do want to tell you that when we look at epidemiological studies, like in the Women's Health Initiative that was run out of Harvard, by the way, and we look to see how many people ate a diet like this, we found that 0% of all people ate everything that was on this diet. So I don't think that it doesn't sound radical, but maybe for our population, ultimately it is. So last, I want to thank you guys all for listening and holding off your lunch to be able to hear about our research and studies. Thanks.